To Noel PTV mic test. Saan ngayon makita no ko? It's working, the microphone. Mag-check lang po ako ng microphone if it is working. Hello. Hello. The mic is working fine. Hello. The mic is working fine. And that is how you check for check for microphone test. So welcome to our live stream. Today is the pang-ilan ba ngayon? I don't keep track. Today is the 6th of October 2020. At ito ang I think it's our fourth, if I'm not mistaken, fourth live stream on YouTube app since we got monetized last month. Okay, so to keep the ball rolling, so welcome to everyone who will be visiting our recorded video or live stream. So we are broadcasting from La Union, Philippines. And you are watching Noel PTV. Our topic for discussion this night is about healthcare services, especially an introduction to physical therapy specialization. Before we proceed with our live stream, our discussions on live stream, I have shout outs from my father. So we have a list to shout out. I would welcome our fellow Oribio family from various parts of the province and also from Pangasinan and Nueva Ecija. So shout out to Hilda Oribio, Nachor, Hilda Oribio Nachor, Jennelyn Oribio, Barnachea, Cory Simbre Oribio, Jesus Oribio Olay, Cindy Oribio, Jason Oribio, Lani Palma Oribio, Anna Joy Oribio, Consigna, Hyacinth Oribio, from Barangay Bacag, Villasis, Pangasinan, Reca May Ella Oribio Peralta. And from Nueva Ecija, Alexandra Oribio and Alexander Oribio. And welcome to our YouTube live on Noel PTV. Please subscribe to our channel and click that notification bell. Like and watch our videos and share it on Facebook so we will have more subscribers. So I'm Noel Uribio. I'm a registered physical therapist in the Philippines. I'm also an aspiring doctor of naturopathy and aspiring doctor of physical therapy. I have a clinic in San Fernando City, La Union, the Integrative Physical Therapy and Wellness Center, with a satellite clinic in Urdaneta City, Pangasinan, mostly every Wednesday and Saturday. In San Fernando City, I do clinics on Tuesdays, Thursdays, and Sundays, and all treatments and consultations are by appointment only. We also have a community-based rehabilitation clinic in Nagilian, La Union for special children. Okay. One of the primary reasons, so parang ano po ngayon, English challenge. So we will have a discussion on English for the whole hour until 10 p.m. tonight. And if you have questions regarding physical therapy, you may drop your comments down below and we will have a part 2 on Thursday. So this is an introduction to the physical therapy specialization. And I have been a physical therapist since 1999. I graduated from LORMA Colleges in San Fernando City, La Union. And I passed my PRC board exam, Professional Regulation Commission, board examination in August of 1999. So I'm one of those early batches of graduates from LORMA Colleges. Pang ano po kami, panlima if I'm not mistaken. We are the fifth batch to graduate from LORMA Colleges. And we already have co-graduates from LORMA who are abroad and who have already accomplished their doctoral education. So there are doctors of physical therapy in the United States of America. In the Philippines, physical therapists are required to pass the board exam to get the title PTRP, Physical Therapist Registered in the Philippines. During my time in 1999, the passing rate was only 15%. So only 15 out of 100 examinees passed the board exam for each year. So for each date, kasi we have 2 dates every year for board examination. So most of my classmates passed the second or the third time they took the board exam. For now, we also have Masters of Physical Therapy and Masters of Science in Physical Therapy from the state universities in Manila and elsewhere. And also, I think we have one university in the Philippines offering the Doctor of Physical Therapy um, curriculum in the Philippines. But of course, when you graduate from the Philippines, if your university is not accredited elsewhere outside of the Philippines, then you cannot use your title as a doctor of physical therapy in other places. Pretty much the same, but from the United States of America, so we have one university, University of Montana, offering the transitional doctorate in physical therapy, TDPT, in cooperation with FEU, Far Eastern University. So you need to be licensed in the Philippines and practicing in the Philippines to be able to get the benefits. It's actually a discount, a big discount to enroll the Doctor of Physical Therapy, which is almost 3 years to take. So it's called transitional because you graduate as a bachelor's degree holder and then you take your postdoctoral degree from bachelor's to doctoral. So you don't need a master's degree to take that transitional doctorate in physical therapy. But you are required to have at least, I think, 2 years of clinical practice, and you are continuously practicing your physical therapy profession before you get qualified to enroll to the doctoral or postgraduate doctoral degree, clinical doctorate. Okay. So maybe you are shocked with us speaking in English tonight. In previous live streams, we've been talking in purely in Tagalog, and the one we had at the Bawang River is mostly in Ilocano. But for tonight, I would really want to impress the minds of our viewers that we Filipinos are really good in speaking various languages, especially English, because we have been under the American system for so long, and our educational system in the Philippines is really based on the English language. So although we are not native English speakers, we can easily practice our tongue and get whatever um, nuances that native speakers have. As for me, I've been trained in American English accent, but some Filipinos are really good with British accent and other forms of English speaking techniques or nuances. Okay, so back to physical therapy. I will be having an interview with first year physical therapy students this Thursday, and we will still have it on YouTube Live. But for tonight, I would just like to introduce some of the experiences that I've had with the physical therapy profession, especially as a clinician in the Philippines. So from on Tuesdays, Thursdays, and Sundays, I do clinics at the San Fernando City main clinic in La Union in the Philippines. And mostly my clients for now are spine patients or with those neck or back pains or postural problems, even scoliosis and stuff like that, or slip discs. Of course, in the Philippines, our law that dictates the practice is Republic Act 5680 or 5680, or the Physical Therapy and Occupational Therapy Law of, I think, 1960 or something. So it's a very old law. It's really outdated. The occupational therapy profession already have their separate law for now, I think, but I don't know the or when, how or when they would, implement the parts of the law of the occupational therapy law, because in essence their board of examiners has been incorporated with the board of examiners of physical therapists. But with the new law for occupational therapy, they will have a separate board of examiners for their licensure, and hopefully also they will have the practice law. We have also a physical therapy law, an upcoming PT law. I hope it will be passed soon. So we will have a practice law in the Philippines. So for now, we are operating under RA 5680, which actually dictates that we do not have direct access for our clients or our patients. So before a client or a patient is seen by a physical therapist, one must go through a medical doctor, a physician. And upon screening or initial examination, if the physician deems that the client or patient needs physical therapy, then they will prescribe physical therapy or refer one to a physical therapist, of course registered in the Philippines. Okay, so how do a medical doctor prescribe PT? So just a simple note for PT. So that's it. So you have your name and a prescription by a doctor for PT, and then the doctor will sign the prescription. So you will take that referral to your PT, and then your PT will make his or her initial evaluation and make a plan of action management. So we will be able to design your physical therapy program and progress you along the way, and then we'll give you a progress report for your doctor when you go back for your consultation. Okay, so does that mean that physical therapists are under medical doctors? Of course not. So as professionals, physical therapists have we are independent practitioners. So the medical doctor is not a licensed PT. So the job of a medical doctor is to diagnose a condition and to refer accordingly to a physical therapist as needed. And in the United States, where physical therapy is already a doctoring profession, a doctor of physical therapy in some states would actually get to assess or evaluate a patient without a referral of a physician. So that's how they operate in the States. But we hope that with the changing times, clients would also have a direct access with physical therapists in the Philippines in the coming years. Okay, so how do you go through with the treatment? No? So what are the treatments done by a physical therapist? Do we prescribe medications like the medical doctors do? No. So medical doctors are authorized by law to prescribe medications, so in the form of tablets or injectables or other treatments. But physical therapists are authorized by law to provide physical therapy management or treatment. So physical therapists are movement specialists. So we analyze movements of body parts, and we also analyze muscle strength, joint range of motion, balance and coordination, endurance, function, and all the other stuff that make up human movement. So if a patient or a client undergoes a disease or an illness or an accident or a surgery, and the movement is affected, so automatically a physical therapist is needed to provide services from initial evaluation to progression of management to discharge from physical therapy treatments. Okay, so in the Philippines, when you graduate and you get your license, like majority of your practice would be focused on stroke rehabilitation. So in stroke rehabilitation, clients have either half of the body paralyzed or weak. So hemiparalysis or hemi-weakness. And we do a lot of home treatments after hospitalization. We also have, like in my case, I do outpatient clinics. So my treatments are outside the hospital. So the clinic is a standalone clinic. So we are not within a hospital environment. So the client, when he goes home from hospitalization, either goes through a bout or several set or times of home physical therapy, and when they are able to go out of the home and do outpatient treatment, then they can come to the clinic for their physical therapy. Another question: is physiotherapy the same with physical therapy? Yes, the answer is yes. In countries like Canada and the United Kingdom and other parts of the world where the British colonized, physical therapy is called physiotherapy. So like India, so they call physiotherapy, or in Singapore or Malaysia, so they call them physiotherapy. But for American colonized countries like the Philippines, we call it physical therapy, but it is one and the same. So physio or physiotherapy, physio, is the same as PT or physical therapy. In the Philippines, I found out that some people claim to be physios. So they call themselves physio, but they do massage. So massage therapy is very much different from the practice of physical therapy. Although massage as a manual therapy is a technique incorporated by manual physical therapists like myself. So I do soft tissue mobilization. Sometimes it's called massage. Sometimes it's called mobilization, soft tissue mobilization. Okay. But for massage therapists, they do wellness treatments like in a spa. So for physical therapists, we do wellness, but mostly the number one modality would be therapeutic exercises. Okay. So we touch a bit of that. In part 2 of our live stream, we will delve deeper into the practice of manual manipulative physical therapy as we answer questions from our interviewers, our first year physical therapy students from LORMA Colleges. Okay, so let's go back to LORMA Colleges. So I graduated in 1999, and the physical therapy course in the Philippines has been designed for 5 years. So 4 years of full-time academic study. So first 2 years would be arts and sciences, like the maths and English and sciences, social sciences and stuff like that. And then you do your major subjects on the 3rd year and the 4th year. So unlike in nursing, where they do nursing college, where they do hospital duties and clinic duties during their 3rd year and 4th year of schooling, physical therapy internship is on the 5th year. So that's our clinical internship. In other courses, they call it the OJT, or on-the-job training. But in clinical internship, so you are still a student under your college, but you are endorsed to a certain hospital, a clinic, or a foundation, community-based setting, where you will practice physical therapy for a month, and you will be under the care of the staff, clinical staff of that institution. So I have a document. So this was my list of affiliation centers in 1998 and 1999. So each month we get to interact with other interns of physical therapy colleges in certain institutions around the country. In more prestigious universities in Manila, they also have the option to do internship outside of the Philippines, like in Singapore or in Japan, where they have exchange programs. So students from Japan come to the Philippines, and interns from the Philippines also go to their country. But for LORMA colleges, we focus, our curriculum is okay. So we're back. I hope we have our connection going. Okay, so in May, I started my internship, clinical internship with LORMA Colleges in May of 1998. And I finished it in February of 1999. So the graduation was in March of 1999. It's actually, if I'm not mistaken, it's March 8th, 1999. Well, let's see my transcript. It says, oh, March 13, 1999 was our, or is our date of graduation. So the document says, this is to certify that Oribio Noel has completed the requirements and is okay. So at SLU Hospital of the Sacred Heart, my clinical supervisor was Ma'am Dorina Taiza, PTRP. I completed my requirements in May 18. Okay. And then the second month was June 1998. My second center was again in Baguio City. It was the Kapisanan ng May Kapansanan, or Organization of the Disabled. I think it was the Stimulation and Therapeutic Activity Center, STAC Center in Baguio, where they specialize in treatment of cerebral palsy and childhood related conditions. So my clinical supervisor was Joel Jerome Trinidad, PTRP. And then my third center in July of 1998 was in Las Piñas. It was a community-based rehabilitation program, sharing our caring foundation. Sharing our caring foundation. And my clinical supervisor was Dalia V. Tividad. And in August of 1998, I came back to Northern Luzon, Central Luzon, at Tarlac City, the Central Luzon Doctors Hospital. And Ma'am Hilda L. Cortez, PTRP, was our chief physical therapist, I think. And then in September of 1998, I was assigned in Malolos, Bulacan, Polyskills Physical Therapy Clinic. So it's a community-based center. It's an outpatient clinic, and we get to stay at the same area. Actually, it's the second floor of the clinic for our housing. So we rented the second floor um, for the whole month of our internship. And Sir Alvin V. Mina, PTRP. Wow, his license number was in still 4,000 something. My license number is 8,000 something. And on October 1998, I was assigned at Baisa Novaliches, RS Rehabilitation Specialist. Okay. And clinical supervisor was Prima Paz P. Valera, PTRP. Okay, the supervisor at MOCB was Vincent G. Maglaya Jr., PTRP. And then December, I came back to La Union, December 1998, at the Ilocos Training and Regional Medical Center, where our chief physical therapist was Sir Ludovic Michael V. Famorca, PTRP. And for the last 2 months of my internship in January 1999, I went back to Baguio City at the Baguio General Hospital and Medical Center, where Madam Maria Victoria S. Oribello PTRP was the chief PT, and in February at the Philippine Military Academy, Fort Del Pilar Station Hospital in Baguio City, and Ma'am Ethel Flor de Lane L. Agbulos was the chief physical therapist. Wow, her license number was in 3,000 something, Ma'am Ethel. So our clinical coordinators back then were Ma'am Marilyn L. Cornelio, PTRP, Ma'am Lani R. Estioco, and Sir Elpidio B. Reyes Jr. And our dean was Dr. Edward D. Lingayo Jr. So for graduating physical therapists, you need to have your certificate of um, internship with all the signature of your clinical supervisors from the hospitals that you do your duties every month. Okay, so that is our internship. So what courses, what subjects do you take if you want to study physical therapy? As I've said earlier, for the first 2 years of physical therapy education, you still need to undergo arts and sciences. So, well, I have a transcript. This is funny because this is not my transcript of records. This is a transcript of Dr. Joey Hermosura, DPT. So he requested one from LORMA through me, and I wonder why I was not able to send him this one. Probably it's an extra copy. So Joey Hermosura is a batchmate of in the College of Physical Therapy at LORMA in 1999, and he finished his Doctor of Physical Therapy from the University of Montana, where I also plan to pursue my transitional doctorate in physical therapy. So the usual courses for the first 2 years, you have history, economics, English, math, and we have zoology. So it's general zoology, and then Filipino, PE, Bible. We then had the Reserve Officer Training Course, ROTC. And then we have computer science. We also have psychology, which is general psychology with drug education. And continuously with mathematics, PE. We also have Bibles. Bible has 2 years of physical therapy education. You also have philosophy, chemistry, and physics. Okay, and then on the third year, which is the focus of our concern in physical therapy, because in various colleges like in nursing and in medical technology, you have similarities of subjects in the first 2 years, which is in the arts and sciences, and then do you diverge, you have different subjects when you come into your major subjects, which is on the third year. So our first semester in 1996 to 1997, we had anatomy, physiology, and psychiatry. So those are big subjects. The anatomy one has lecture and laboratory. So expect a dissection of human bodies or cadavers, no? Dead bodies, when you enter into your third year. Um, that's a 5 unit course. And then physiology one, which is a study of function, anatomy, study of structure. So 5 units also. And psychiatry one, we discuss on psychological reactions to disability. So as a physical therapist, one needs to understand how a client um, processes life experiences as with disability, from being able to becoming disabled. So the process of rehabilitation. So from um, denial to anger to bargaining to until you get acceptance, where it will really aid in your rehabilitation in your physical therapy sessions. So a big deal goes to psychology and psychiatry besides your skills in physical therapy. So those are the first three subjects. So that's 13 units. And then you have 8 more units for physical therapy applications, which is PT1, which is actually an introduction to physical therapy care, hydrotherapy. You see, we have massage and superficial heat. So, physical therapy 1 introduces you to the various techniques of physical therapy with the use of water and manual therapy as well, and heat. That's a 4 unit course, so we have lecture and laboratory. And then physical therapy 2, which is PT2, electrotherapy, another 4 units. So electrotherapy is a big part of physical therapy practice. So we do electrical stimulation, and we also have therapeutic ultrasound. We have diathermy. Now we even have shockwave therapy. We have laser. We have red light therapy, infrared, and stuff like that. So that's a 4 unit course. So it's a very technologically advanced subject. So you study on waves, electric current waves, sound waves, light waves, stuff like that. And how you're gonna use this into the rehabilitation and the treatment of your patients. So whether they are um, needing your help for pain management or for range of motion for joints that are too tight or too stiff, or for muscles that are too weak or paralyzed, and a combination of one or two or all of it. Okay, in the second semester of the third year, you have anatomy 2, which is an dissection of internal organs, face, and neuroanatomy. So we also study the brain and the internal organs. So we still have dissections for the second semester of the third year. Actually, the third year of physical therapy education is one of the hardest, I think, semesters, because you are bombarded with so much information from anatomy to physiology, you know. And then you have therapeutic exercises. Of course, after anatomy 2, you have physiology 2. So you have a study of functions of organ systems. And then therapeutic exercise 1, you study the types of exercises and the various postures, and how you as a physical therapist would provide services to correct such abnormalities or dysfunction in posture and movement. So you will study ergonomics as well, and you will study the normal postures of the spine and the extremities, and how much pressure are being exerted when your client is seated for a long time versus a client who is upright in the standing position or walking. Also, we have a medical surgical subject, which is pathology and microbiology. This is general pathology and general microbiology. So you will study, cellular basis of dysfunction, like diabetes. You will study how diabetes came about, and how physical therapists would intervene in such conditions, medical and surgical conditions. Oh yeah, medical muna. And then we also have physical therapy 3, which is principles of evaluation. Here you will study mostly orthopedic tests, special tests for orthopedics. You have the upper extremity and the lower extremity, even the spine. And then you study how to measure joint range of motion, the normal ones and the dysfunctional ones. And then you also learn normal and abnormal end feel. So when you bend your elbow, so how would you know that it's normal and abnormal? Is it too much or minimal joint range? And then you will also study on manual muscle testing. So you will do grading, like grade 5 is normal, 5 out of 5. So what is grade 4? What is grade 3? Of course, 0 is none, as in paralyzed. And then you will also study on history taking. So you will learn how to interview your client or patient for past medical history and history of present illness, personal, social, environmental history, family history, and stuff like that. And do charting. So you will learn how to do problem-oriented medical record, POMR, and also the more sophisticated one, which is the Kettenbach, which is a narrative Kettenbach format for medical charting. The new types of charting in the US, as sent by Mom Arlene De Vera, Dr. Arlene De Vera. She's also the previous chief of PT of LORMA Medical Center, but she also already have a practice, a private practice in the States. So she finished her Doctor of Physical Therapy as well. So that is the third year. And when you reach your fourth year, you will still have anatomy. Anatomy 3, which is kinesiology, the study of human movement. So you will study the shapes of human joints and how many planes of movement they have, and how would you mobilize such joints as well, and then what factors like motor control, muscle attachments to bones would produce specific normal and abnormal movements in the human body. So that is your kinesiology. That's 5 units. And then you have therapeutic exercise 2, which is a study on specific exercises, such as progressive resistive exercises and stuff like that. And actually these are specific exercises for approaching systematic conditions. Like if you have a patient with obstetric concern, like a lady who has just given birth and she has a weak pelvic floor. So one of the specific exercises that you would do is Kegel exercises, or strengthening of the pelvic floor. Another one is an orthopedic condition, a musculoskeletal condition known as the adhesive capsulitis or frozen shoulder. So in therapeutic exercise 2, you will learn Chandler's exercises, Sperry's exercises, and stuff like that. And also joint mobilization. So you know the grades of mobilizations for your peripheral joints. In the bachelor's degree in the Philippines, you do not study spinal mobilization. You only do peripheral joint mobilizations. Okay. And the same semester of the first semester of fourth year, you will have 2 subjects for medical and surgical conditions. So medical surgical 1, you will study general medical conditions. So from hypertension to glucose or elevated glucose level, to diabetes, to hypercholesterolemia or high level of fat in the blood, to AIDS, acquired immunodeficiency syndrome or HIV positive, to various conditions that are really medical in nature. Okay, and then MS2 or medical surgical 2, more specialized in neurology. So brain conditions like Parkinson's disease, Alzheimer's disease, and traumatic brain injury, all the stuff that affects the brain and the spinal cord. So neurology. Of course, neurology will also affect the specific nerves, peripheral nerve injuries, like for your extremities, upper and lower extremities. So it's a really big topic. But MS1, which is general medical conditions, because of the wide topic, would actually require 5 units of study. Neurology has 3 units of study. And then you will have physical therapy 4, which is considered a minor actually with 2 units, but it is really a big thing when you do your practice later on as a professional PT, organization and administration. And then one of the hardest subjects is seminar 2, although this is only 2 units, this is clinical correlation team approach. So your clinical instructor will not provide lectures. You, as the class members, will report a specific condition and will provide also a client or a patient evaluation, whether hypothetical or actual in nature. And then we have physical therapy 5, which is physical therapy pharmacology. Yes, we still study medicines like um, paracetamol, pain relievers, um, the usual cardiac medications, digoxin, atenolol, metoprolol, stuff like that. Or for your amantadine sulfate, for your Parkinson's disease, and stuff like that. So in physical therapy, we still have a 2-unit subject for physical therapy pharmacology. So you study the nature of medicines and how they affect the individual function, how consciousness is affected if the patient has central acting stimulators or depressants. So you would not expect a patient to participate in your physical therapy session if they are under heavy relaxant or CNS relaxation medicine like Rivotril or a sleeping pill. So in the US, they have evening physical therapy like 6 to 7 p.m. But in the Philippines, we only have it until 5 p.m. In nursing homes in the US, they do morning and afternoon sessions. Okay, this is funny. We still have Filipino 2 in third year because we missed some units. No? In the first 2 years, they had to add one subject, Filipino 2, during our major third year subject, which is 3 units. And then we have the second semester, the last academic semester for physical therapy, fourth year. We have medical surgical 3, which is actually general surgical conditions, radiology, and miscellaneous. So yeah, I would like to correct that. I said we study the surgical conditions are under MS1, which is medical surgical 1. No, that is only for medical conditions. For MS3, we have general surgical conditions. So why do we need to study surgical conditions? Because we provide services for post-op or clients who have undergone operations. So you need to know what type of surgery they have undergone and what precautions are needed before you provide your physical therapy management. And then we have therapeutic exercises 3, which is advanced therapeutic exercises and proprioceptive neuromuscular facilitation. That's TheraX 3. We also have physical therapy 6, which is orthotics and prosthetics. This is a minor subject though, 2 units, so you need to learn about braces. So spine braces, postural braces, extremities, and also you have for amputees, prosthetics or for clients who have amputation above the knee or below the knee and they require prosthetics or your artificial limb. And then we have clinical education 1, which is introduction to clinics. It's actually an introduction where you visit outpatient clinics as well. Seminar 2, which is a continuation of the previous semester. Clinical correlation and team approach, still 2 units. But in this subject, you are required to present again a specific disease or disease entity or condition with an actual client evaluation. So you will present the initial evaluation, of course safeguarding the identity of the client or following confidentiality rules for medical records. And then you need to correlate what you have learned from the books and what you see in the actual evaluation. And then you will try to create a plan, a program of physical therapy management that you would do with the client. And then you need to discuss it with your clinical instructors and convince them that you have understood the condition or disease entity that was assigned to you for your report. So this is a very challenging subject. When I handled this in my first year of teaching, almost, I think, half of the class failed, and they had to retake the subject in a summer class for seminar 2. And then we have ethics in physical therapy, 3 units, and then physical therapy 7, which is actually a continuation of your organization and administration. Physical therapy practice, I think they do not have this now with the current curriculum. They have incorporated this with other PT subjects. And then lastly, we have medical surgical 4, which is pediatric rehabilitation. So you discuss conditions that affect children, like cerebral palsy and osteogenesis imperfecta, or OI. Actually, it's an orthopedic condition still, but still a pediatric rehabilitation concern, and more. So after you complete your first 4 years of academic training and you pass the revalidation or the or comprehensive examination, you are now qualified to take your 5th year, which is clinical internship. This is 10 months, clinical internship 1 and clinical internship 2. So the whole year, 5th year, is a total of 30 units. 30 units for the 5th year. Okay, so that is how difficult the curriculum is in physical therapy. So, and then after you graduate, you still cannot practice physical therapy until you pass your board of physical therapy or your board examination with the Professional Regulation Commission. Okay, in our class, batch 1999, it was very challenging for LORMA Colleges because in 1999, like 60 plus of our class graduated, and for the first take, only 3 of us passed the board exam that year. That was August 1999. So just say we took like 65 or 60 something, and only 3 passed the board exam. So that's how difficult the board exam was. But in the second take, in the third take, there were a lot of my classmates, batchmates, who passed the board exam, and they get to practice. Those who were not successful with the physical therapy profession shifted to nursing, and they are already abroad practicing the nursing profession. One of my classmates also shifted to medicine. So although he was not successful with the physical therapy board examination, he was able to practice, finish medical schooling, and then graduated and had license, and also now a successful orthopedic surgeon. Okay, so if physical therapy is not your thing, you need to look for other venues for your professional practice. Okay, so why take physical therapy? So when I graduated in 1999, or even when I enrolled in the course, the focus was to go abroad, especially in the US. But one thing led to another, and I'm still in the Philippines, and I'm practicing physical therapy. So I guess PT is just one of the you know specialized services in the healthcare profession that you get to put up your own clinic and practice as an independent practitioner without the direct interruption or intervention of other healthcare professionals. So you would only need a referral, and you make your own evaluation, and you design your own plan of treatment, and then you progress, And if by evaluation the client is not under your special areas of expertise, then you have to refer out or recommend services of other healthcare professionals. So that's it. So how would we see physical therapy in the coming near future? Well, our physical therapy practice in the Philippines is actually based on the American model. So in the American Physical Therapy Association, 2020 Vision 2020 was that physical therapy is a doctoring profession. So right now, all physical therapists in the US are, pursuing their doctoral education. And that is also our direction for physical therapists in the Philippines. But right now, you only need a license to practice in the Philippines. Um, as a PT in the Philippines, I am a lifetime member of the Philippine Physical Therapy Association. So the the website is philpta.org. Okay, I will just read the nature of physical therapy as defined by the Philippine Physical Therapy Association. So, physical therapy provides services. So, as a member, I subscribe to this definition. Physical therapy provides services to individuals and populations to develop, maintain, and restore maximum movement and functional ability throughout the lifespan. This includes providing services in circumstances where movement and function are threatened by aging, injury, disease, or environmental factors. Functional movement is central to what it means to be healthy. Physical therapy is concerned with identifying and maximizing quality of life and movement potential within the spheres of promotion, prevention, treatment or intervention, habilitation, and rehabilitation. This encompasses physical, psychological, emotional, and social well being. Physical therapy involves the interaction between physical therapists, patients or clients, other health professionals, families, caregivers, and communities in a process where movement potential is assessed and goals are agreed upon using knowledge and skills unique to physical therapists. Okay, so that's a wordy statement, but what it means is we also take part in wellness, which is prevention, preventive healthcare. So most of the time, people will get to know physical therapy practice when a family member has a stroke or a family member met an accident and they had a surgery, and after that the doctor would refer them to physical therapy. But in our current practice, because of the increasing active lifestyles of even Filipinos and people in the States and other parts of the world, physical therapists are now going into the fitness industry as well. So I have a companion with me who trained in Singapore. So we trained in Singapore for Special Olympics Asia Pacific. And ever since she had her license, her practice was focused on the fitness industry. So she had additional certification with American organizations focusing on fitness as well. Okay, so as also a physical therapist in the Philippines and a member of PPTA, we are also member of the World Physiotherapy or WCPT, which is the World Confederation for Physical Therapy or Physiotherapy. So the definition according to WCPT, so physiotherapists have different titles in different countries. In many countries, they are called physical therapists. Some countries have their own version of the word physiotherapist, such as kinesiologist, but they are all part of the same profession. Okay, so kinesiologist, physiotherapist, physical therapists are all one and the same. Physiotherapists provide services that develop, maintain, and restore people's maximum movement and functional ability. They can help people at any stage of life when movement and function are threatened by aging, injury, diseases, disorders, conditions, or environmental factors. So this is from WCPT, which is I automatically become a member because of my organization, which is PPTA, is a member organization of WCPT. So physical therapists or physiotherapists help people maximize their quality of life, looking at physical, psychological, emotional, and social well-being. Okay. So sometimes we tend to think that physical therapists only focus on the physical functioning, but we should also focus on psychological, emotional, and social well-being. So you cannot separate these factors or elements of humanity and just focus on physical function, right? So they work in the health spheres of promotion, prevention, treatment, intervention, and rehabilitation. So it's actually a restatement. These statements are restated by the Philippine Physical Therapy Association. Okay. Also, as a subspecialist, no, I subspecialized in manual manipulative physical therapy, and I am a member of the Philippine Association of Orthopedic Manual Physical Therapists, or PAOMPT. Medyo mahaba. Yan. Hello po, welcome to our live stream. So we're almost done, but this is only part 1 of our introduction to physical therapy. We will have part 2 on Thursday, 9 p.m. and we will welcome our first year physical therapy students who will be giving questions as their interviews as a requirement for their Physical Therapy 1 subject with the College of Physical Therapy of LORMA Colleges. Okay. Actually, we will be having an online convention. I haven't registered yet for PAOMPT, which is the Philippine Association of Orthopedic Manual Physical Therapists, scheduled for October 24. And my October 17. October 17. I think this is 2 weekends. October 17 and October 24. Okay. Previously, or even now, right now, physical therapists in the Philippines are really general practitioners. So we do neurologic physical therapy, we do musculoskeletal physical therapy, and we even do integumentary physical therapy. In the States, they specialize. So when you do your master's degree, UST and UP have their masters in physical therapy and master in of science and physical therapy, and you choose which track to take. So either you go for neurologic track or orthopedic track. So in my practice, I choose to go for orthopedic manipulative physical therapy. That's why I joined the organization, the Philippine Association of Orthopedic Manual Physical Therapists. And it is also a special interest group of the Philippine Physical Therapy Association. And internationally, it is under the International Federation of Orthopedic Manipulative Physical Therapists. I was asked oftentimes if I do chiropractic or chiro. No, I'm a registered physical therapist, and I'm also a trained osteopathic manipulative therapist. So there's a difference. In our future live stream, we will also discuss on osteopathy and other practices in healthcare services and wellness. Hello, welcome to our live stream. We're almost done to our introduction for physical therapy. We will have part 2 on Thursday. Okay, so the Philippine Association of Orthopedic Manual Physical Therapists will have the online convention for October 17 and October 24, and we have international speakers as well. Um, for those who have questions with physical therapy practice, you may want to leave your comments down on the comment section, and we will get back to you on our next live stream, which is on Thursday at 9 p.m. So I hope you've learned some things with the physical therapy education, the physical therapy practice, and the physical therapy profession. So this is a continuing series of discussions to educate the public on the physical therapy practice in the Philippines and elsewhere. Um, I opted to speak in English for this live stream for purposes of worldwide audience. So I hope that we would impress the worldwide audience that Filipino physical therapists are internationally competitive, and we are trained and we are certified to provide services, healthcare services. And we hope that we would also continue until all physical therapists in the Philippines would achieve their Doctor of Physical Therapy degrees. And we will all have our specialized services and clinics in every region in the Philippines. So once again, thank you for coming to our live stream. We will end this now in a minute or two. But again, I would give my shout out again to our Oribio relatives, Hilda Oribio Nachor, Jennelyn Oribio Barnachea or Barnachea, Cory Simbre Oribio, Jesus Oribio Olay, Cindy Oribio, Jason Oribio, Lani Palma Oribio, Ana Joy Oribio, Consigna, Hyacinth Oribio, and from Barangay Bacag, Villasis, Pangasinan, Recame Ella Oribio Peralta, and from Nueva Ecija, Alexandra Oribio and Alexander Oribio. Please subscribe to our channel and click the notification bell so you will be notified if we have new videos and live streams scheduled for your convenience. Please also watch and like our videos and share videos on Facebook, so more we will learn from Noel PTV, which is our channel for wellness, health, and more sharing among friends. So thank you very much. So for now, we have a few seconds remaining, and we will shift from English to Tagalog to Ilocano na. Okay. Salamat po sa pagpunta. Introduction to physical therapy po. Ako isang Tagalog na, no? Physical therapist sa Pilipinas. Ang clinic ko po ay nasa San Fernando City, La Union. So I do manual manipulative physical therapy. I do spine treatments for neck and back pains. And also I do postural treatments for scoliosis and for slip discs and stuff like that. And we also have wellness treatments including acupuncture, traditional Chinese acupuncture, and we also have the Western acupuncture, which is dry needling. Pwede nyo pong i-check yung mga videos natin, mga previous videos, makita niyo yung mga activities natin. So ang main clinic, Tuesdays, Thursdays, and Sundays sa San Fernando City, La Union. Our satellite clinic is in Urdaneta City, Pangasinan. And on Wednesdays and Saturdays. At ang ating community-based rehabilitation clinic sa Nagilian, La Union, which is focused for treatment of special children. Ayan. So once again, thank you very much for coming. At gagawin po nating regular yung live streams natin at 9 p.m. The next would be on Thursday. Again, thank you very much, and we hope that everyone continues to be productive, maging active tayo despite the challenges of the pandemic. So wag tayong magwalo o masyadong nagtatalo ng isip ko kung English or Tagalog or Ilocano yung gagamitin ko. Because if we try to wallow in our despair, in our stress, in our anxiety and sometimes depression, to the point of depression, this will lead to nothing but more sadness and, feelings of loneliness and feelings of hopelessness. So if we focus on the stuff that we can achieve, like if we focus on actions that we can do, then we can get out of our sadness, and we can become productive, and we can even help ourselves and other people. So kung kulang tayo sa employment at this time, we look for other sources of income. Tulad ng kinukwento ko yung mga caregivers namin dito sa bahay, pag uwi nila, they look for stuff that they can buy and they sell online. So tanim o mga pagkain, no? Online or on ground. So naglalakad sila to sell. The best medication for anxiety and depression is actually daily exposure to sunlight and exercise. Walking is a very good form of exercise. And we need to continuously eat healthy and drink enough fluids, no, especially tubig, and have a lot or adequate sleep. So yung mga natural elements ng healthcare and wellness would actually help us to get over our sadness and our anxiety and depression. Of course, prayers, no? So God is in control. So whatever problems we have now, God has a plan. So kung may plano tayo dati na hindi nasusunod, it's okay. God is in control. So let us pray for strength, and let us pray for His intervention. Kung nahirapan tayo sa mga situations natin, we ask for help from our friends and our family members, and then they will provide the assistance that we need, and at the same time makatulong din tayo sa kanila. So don't lose hope, keep fighting, and help a lot of other people, and in the process we will help ourselves. So thank you for tuning in to Noel PTV again. Have a blessed night, and thank you. And again, see you on Thursday at 9 p.m. Good night. Bye-bye.